AB abortion. AF amniotic fluid. AFC antral follicular count. AFE amniotic fluid embolism. AFI amniotic fluid index. AFLP acute fatty liver of pregnancy. AFP alpha fetoprotein. AFV amniotic fluid volume. AGA appropriate for gestational age. AMA advanced maternal age. APH antepartum hemorrhage. APSN atypical placental site nodule. ARM artificial rupture of membranes. ASC atypical squamous cells. AUB abnormal uterine bleeding. AV arteriovenous. Beta HCG beta human chorionic gonadotropin. BBOW bulging bag of water. BCP birth control pills. BM bone mineral density. BOW bag of water. BPD biparietal diameter. BPP biophysical profile. BRF breastfeeding. BRP bathroom privileges. BSO bilateral salpingo oophorectomy. BTBV beat to beat variability. BTL bilateral tubal ligation, beetle. BUFA baby up for adoption. BV bacterial vaginosis. BW birthway, CASA computer assisted sperm analysis. CE cervical exam. CEFM continuous electronic fetal monitoring. CF cystic fibrosis. CIN cervical intraepithelial neoplasia. CKC cold knife conization of the cervix. CMT cervical motion tenderness. CPD cephalopelvic disproportion. CPM confined placental mosaicism. CRL crown rump length. CS cesarean section. CST contraction stress test. CTX contractions. CVS chorionic villus sampling, DC dilation and curettage. D dilation and evacuation. Cyst ductal carcinoma in situ. DUB dysfunctional uterine bleeding. EAB elective abortion. ACC endocervical curettage. ECL echogenic cystic lesion. ECV external cephalic version. EDC estimated date of confinement. EDD estimated date of delivery. EDF end diastolic flow. EFM external fetal monitoring. EFW estimated fetal weight. EGA estimated gestational age. ELF elective low forceps. EPA early pregnancy assessment. EPT estrogen and progesterone therapy. ERCS elective repeat cesarean section. FA fertility awareness. FBS fetal blood sampling. FF fundus firm. FGR fetal growth restriction. FH fetal heart. FHR fetal heart rate. FHT fetal heart tones. FL femur length. FLM fetal lung maturity. FM fetal movement. FSH follicle stimulating hormone. FWB fetal well-being. G gravidity. GA general anesthetic, gestational age. GAB genetic abortion. GC gonococcus, gonorrhea. GFM good fetal movement. GH gestational hypertension. GI gastrointestinal. GnRH gonadotropin releasing hormone. GS gestational sac. GUSM genitourinary syndrome of menopause. Hypoglycemia and adverse pregnancy outcomes. HB hemoglobin. HBSS sickle cell anemia. HCG human chorionic gonadotropin. HCS human chorionic somatomammatropin. SIL high-grade squamous intraepithelial lesion. HMB heavy menstrual bleeding. HMG human menopausal gonadotropin. HPL human placental lactogen. HPO hypothalamic pituitary ovarian. HRT hormone replacement therapy. HSIL high-grade squamous intraepithelial lesion. IA incidental appendectomy. IBD inflammatory bowel disease. IBS irritable bowel syndrome. IC interstitial cystitis. ICH intracranial hemorrhage. ICSI intracytoplasmic sperm injection. ID incision and drainage. ILF indicated low forceps. IM intramuscular. IMB intermenstrual bleeding. INR international normalized ratio. IOL induction of labor. IUCD intrauterine contraceptive device. IUD uterine fetal death. IUD intrauterine device. IUFD intrauterine fetal demise. IUFD intrauterine fetal demise or death. IUG intrauterine gestation. IUP intrauterine pregnancy. IUPC intrauterine pressure, catheter. IUPR intrauterine growth restriction. IUS intrauterine system. IUT intrauterine transfusion. 4. Intravenous. IVD instrumental vaginal delivery. IVF in vitro fertilization. IVM in vitro maturation. IVS intravaginal slingplasty.